All right, a common myth that we hear a lot actually goes something like this. I heard that Medicare covers everything. Or another way that this is phrased is Medicare covers whatever my doctor and I decide that I need. I'm sorry that I have to be that guy, but this is not true. First off, here's what the Centers for Medicare and Medicaid Services has to say about this. Generally, Medicare covers services and items it considers medically necessary to treat a disease or condition. Notice that this is what Medicare considers medically necessary, not you or your doctor. Now, there are obvious examples which are easy to identify as what will not be covered by Medicare. Medicare is not covering that elective cosmetic surgery to make certain parts of your body bigger or smaller to make you feel more attractive. Medicare doesn't consider that medically necessary. But there are other examples that are not so obvious. Now, it's impossible for me to go over all of those in a video like this, but there are 8 major healthcare categories that most people assume are covered by original Medicare, but most definitely are not. Medicare.gov does have a nifty mobile app called What's Covered that you can download straight to your phone, or you can check at Medicare.gov on your computer as well for things that are covered. It will not only tell you whether or not a service is covered, but it will also tell you how it's covered, like Part A versus Part B and other important details. Just to be clear, even if you see that something is covered, it has to be medically necessary for you. Just because you see crutches on the list doesn't mean that you can go get crutches because you think they're a cool fashion trend. You need to actually have a medical reason that warrants crutches. Okay, I'll go over those 8 major areas, including those ever-present exceptions, as well as how to fill in those holes. For those on or considering a Medicare supplement plan or a Medigap plan, those are the same thing. These pay secondary to Medicare, meaning that if Medicare covers it, the supplement plan will cover it. But what we're talking about in this video is if Medicare does not cover it, the supplement plan does not cover it. So the following are not covered by supplement plans either, with some exceptions that I will note. Now, the first group of gaps I refer to as manageable. Are there ways that you could see expensive bills as a result? Sure, but they are smaller things that are less likely to bankrupt somebody. The second group of gaps will be a bit more intimidating because if they are not filled, the consequences can wipe out a lot of wealth. Let's start with the more manageable gaps. The first is dental coverage. Medicare does not cover dental in the traditional sense of what I think you're thinking. Regular checkups, cleanings, cavities, root canals, work on your gums, all of that tasty stuff is not covered by Medicare. The exception is that if dental work is required to treat a different medical condition, Medicare may cover that. For example, if your face gets smashed and surgery on your jaw is required to treat the whole thing happening with the face, Medicare could cover that. But for everything else, what is one to do? Well, there are standalone individual dental insurance policies that you can get once you move on to Medicare that will give you some level of dental coverage. For those who go on the original Medicare and the supplement plan route, remember that dental isn't included in your supplement plan, and you would buy these dental plans separately. They come with their own monthly costs or premiums. Option number 2 is something called an Advantage plan. These often have varying levels of dental coverage as part of that plan, but Advantage plans work much differently than original Medicare and a supplement plan. So make sure that you know what it is you're getting into with an Advantage plan before just making that jump because of dental. We have several videos on our channel that outline the differences between original Medicare and the supplement plan route and then the Medicare Advantage plan route. Consider subscribing to our channel to see those that we've done and also the ones that we will do in the future, but this video is about something else. Okay, the second manageable gap is vision. Medicare does not cover vision in the traditional sense, again, of what I think you would think of. If you're thinking regular eye exams, glasses, contact lenses, the things that keep your daily vision 20/20, all of that is not covered by Medicare, with exceptions, of course. For example, Part B partially covers eye exams if you're at high risk for eye complications like glaucoma. Medicare also covers some medically necessary eye surgeries such as cataract removal. But Medicare will not cover routine eye exams, glasses, or contacts. So what is one to do? Well, similar to dental, there are standalone vision plans that you can buy separate from original Medicare and your supplement plan if you go that route. They have their own monthly costs and their own coverage options. Option number 2 is the Advantage plan route again, where there is some level of vision typically included in those plans. All right, the third manageable gap. If you heard that Medicare covers hearing, well, it's time to get your ears checked because you heard wrong. Medicare does not cover hearing. So if you have or need things like hearing aids, As of right now, it is not covered. Now, Medicare does cover ear-related medical conditions, just not routine hearing care, hearing aids, or exams for hearing aid fittings. So what is one to do? This is going to be the same as the previous two. There are standalone hearing plans that you can buy if that is important to you, and you go the original Medicare with a supplement plan route, or Advantage plans typically, again, have some level of hearing coverage or discounts as part of that plan. All right, let's start moving into the more intimidating gaps. And the fourth total gap, but the first intimidating gap, is drugs. Medicare does not cover prescription drugs in the traditional way of what I think you're thinking. If you're thinking of prescription drugs as the kinds that you fill at the pharmacy and then you go home with the medications and you take them at home, original Medicare is not covering that. If you're thinking other kinds of prescription medications, well, there are some exceptions, of course. Medications that you receive while in a hospital or a skilled nursing facility can be covered by Medicare Part A. Medications administered by a provider in their office or facility may be covered by Part B. But the more common understanding of prescription drugs, not covered by Medicare. So what is one to do? That's where Part D comes into play. Part D is prescription drug coverage that you can get in the same two ways that we've been discussing with the other gaps. The first is a separate, standalone Part D prescription drug plan that you would get if you went the original Medicare and the supplement plan route. It has its own monthly costs to be aware of. Option number 2 is the Advantage plan, which again will typically have some form of drug coverage as part of that plan. The drug coverage hole here might be a manageable gap for some of you. Some people are on low-cost medications or no medications, but others it can be a very intimidating gap, costing tens of thousands of dollars a year. All right, the fifth overall gap and the next intimidating gap is long-term care. Medicare does not touch long-term care. And you might be wondering, Eric, what is long-term care? We have a few videos on this. One of them should appear right up here. But the super fast, not complete answer to that is think nursing homes, Alzheimer's, dementia, or memory care facilities, home health care for extended periods of time. Those long-term healthcare arrangements that are not in a hospital, those are not covered by Medicare at all. So what is one to do? First, I'd head over to our long-term care section of our website or the playlist in our YouTube channel. They will explain this in a lot more detail, but know that there are long-term care insurance plans that are available for you to purchase outside of original Medicare, outside of the supplement plan. These are not covered by Advantage plans. Long-term care is something that you do separately. Moving on to the sixth overall gap, care outside the U.S. is not covered by Medicare. If you plan on traveling or living in a country outside of the United States, Medicare is not covering the care that you would receive. Medicare is a U.S. program. It's not a worldwide program. Now, to fill that gap, there are a few options. First, know that both supplement plans and Advantage plans typically cover emergency care outside of the U.S. So if you are traveling, as an example, and an emergency happens, you'll have coverage from those plans. Typically, this works as a reimbursement system where you will usually be responsible for paying the full cost while you're outside of the country, and then your plan would reimburse you later based on your coverage. This is for quick trips. If you plan on living outside of the United States, you'll have to look for insurance plans in the country that you'll be living. Medicare isn't helping you there. Now, a notable exception here is that if you live in the United States, but you live close to a border country like Mexico or Canada, if the closest hospital to you happens to be in another country, Medicare may cover that. For example, I'm on a flight from Colorado to Alaska, and we have to do an emergency landing because of me that requires that we land in Vancouver. To treat me, Medicare will step up in that situation. Okay, the seventh gap overall would be excess charges or visiting opt-out providers. If you visit a provider who does not participate with Medicare, you will be responsible for something called an excess doctor charge, which is above the Medicare approved amounts. This is capped at 15% above what Medicare allows. If you're visiting a non-participating provider, you can avoid this charge by visiting providers who participate with Medicare. A supplement plan F or a plan G will cover excess charges. Other supplement plans will not. Now, Advantage plans work differently. You aren't going to see what excess charges would be coded as. They have their own networks where you will get no coverage or limited coverage for visiting out-of-network providers. Now, an important note here, if you have an emergency on an Advantage plan that puts you in a facility or with a provider that does not participate in that plan's network, the Advantage plan is required to cover that as in-network. So whether that's an emergency that happens in your town and they take you to a hospital that's not in network, or you're traveling and an emergency happens, that Advantage plan is required to cover that as in-network. Now, if you are visiting a provider that has opted out of working with Medicare, the semantics here, the words are important, they've opted out, you are responsible for 100% of the cost of seeing this provider. And this should be made very clear, and the provider should tell you this, as the service is a direct contract between you and the provider, not Medicare or insurance. And related to that, the eighth and final gap, which we covered a little bit at the beginning, would be unapproved charges. These are procedures that are not covered by Medicare. This would include things, like I mentioned earlier, with cosmetic surgery, experimental procedures, and some durable medical equipment. You're paying for this out of your own pocket 100%. All right, those are the gaps in Medicare coverage, as well as some ways for you to protect yourself against these gaps. There are always fun exceptions, so if I missed one, it wasn't malicious, just somewhat limited on time, so feel free to throw that in the comment section. If this was helpful, click on that thumbs up button. Be sure to subscribe to the channel. If you'd like to reach out to me directly, my email will be in the description, and I will see you in the next video.